Good afternoon, everybody. This is Darius Assemi, publisher of GB Wire, president of Granville Homes. Thank you for joining us again on Facebook Live this afternoon. With me today, I have Dr. Sorabi, ear, nose, and throat specialist here in the Fresno area, and Dr. Sidhu, emergency medicine physician at UCSF Fresno. Welcome, gentlemen, back to GB Wire Facebook Live.
Thank you so much.
Several items we're going to cover today. Number one, the great results from remdesivir this morning about their clinical trials, over 1,000 folks. Dr. Sidhu can address that. Fresno County's cases are still rising at 521 cases of COVID positive as of yesterday. And there's a vaccine around the corner by Oxford University as early as September. We're going to discuss that as well. And finally, Drs. Masihi and Erickson from Bakersfield, their comments about why we should be opening up earlier than later. So without further delay, Dr. Sidhu, you have the floor on the new remdesivir results that came out this morning.
All right, thank you so much. So this is kind of exciting. New data suggests that patients with severe cases of COVID-19 who took remdesivir can actually have a benefit in the amount of time that it takes for them to heal from this COVID-19, as well as there's also an improvement in their mortality rate. So let's put some real numbers behind this. So the preliminary trial was done in 1,090 patients. It was a randomized control trial done throughout the world, internationally. And it showed that the time for people who recovered from COVID-19 went from about 15 days to 11 days. In addition to that, it showed that the mortality rate for this group was about 8%, which is a lot lower than the 11.6% seen in the placebo group. So both of these things are quite reassuring. The FDA is working on approval for this. Usually this is not done for just one positive study, but in this particular situation, we are in a desperate need for something, some sort of medication, and they're working on that. There are others on the other side of the alley from the World Health Organization who are saying that more trials are needed to actually call this a game-changing drug.
Got it. This could be, again, it could be a game-changing drug,
Yeah.
To be determined hopefully this summer or early fall. Any comments on that, Dr. Sorabi?
Well, the data was just put out today. It was almost 2,000 people, which is pretty small for this kind of thing, but it's still enough that you can make some sort of statement about it. I think that, most importantly, there's some sort of, little spots of light coming up through the darkness where this is working. And yes, it looks like this test is improving. Yes, it looks like there's hope for a vaccine and so forth. So it's good. Great. Let's try remdesivir. Let's see if it works. I think we have a little bit of a, when there's a tense situation like this, anytime we hear one good news, we tend to jump on it very quickly. However, we know that that Fauci and company are a measured group. They're not just going to, I put a lot of weight in the fact that they've looked at it again and a third time before saying this. So fantastic. I know there's been a couple other things that have been put forth as potential, treatments for those infected, and some of those have not panned out, so much. However, this is very promising, and it actually makes a lot of sense why this would be a known antiviral kind of medication. So I'm going to be, a little bit reserved on this as well. But 2,000 is not bad. 20,000 would be better. Over a 6-month period would be better to know. But I'm actually very happy that they are moving forward in this measured way, so that we can give people some real hope in terms of treatment.
That sounds good. Along with that, there's also announcements about the vaccine that's could be out as early as September by Oxford University. Any data on that and your thoughts on that? Dr. Sidhu, we'll start with you.
Sure. So scientists in Oxford University are working on a vaccine. They're doing these studies in rhesus monkeys. They have not yet done it in humans, but they're working on that as well. They're saying that by the end of the month, they can actually have likely an effective vaccine. Now, the next step is to actually produce the vaccine in a large enough sample to get your healthcare providers, elderly, and then the rest of the population inoculated with it to actually get the vaccine. And they're saying that they can actually have a few million doses to start off as early as September, which is the earliest that we've heard from anyone who's working on a vaccine internationally.
That's really incredible news, because we were told as early as 2 or 3 weeks ago that the vaccine could be out in as early as 12, but more than likely 18 months from now. So could be a big game changer, especially if they have enough doses available, at least a couple of million doses. Do you know when they can ramp up to get to potentially 7 billion doses to get everybody vaccinated on this planet?
That's definitely, I don't think anyone has actually looked at that particular number for this group of vaccine, but it would definitely take some time to ramp up. But what we've seen with other vaccines is when we do have them, we do give it to higher risk populations first, and then work our way down to people who are less at risk. So I anticipate they'll probably end up doing something very similar once a vaccine is found for COVID-19.
Great. Dr. Sorabi?
Just a quick question. Actually, I didn't get to, I saw the headlines, but I didn't get into the details of it. Do we know what kind of vaccine this is? Is it live attenuated or?
That is something that I also am not exactly sure at this particular time, but definitely.
Similar to what I'm saying about remdesivir, I think, the fact that this is coming out through a group like Oxford, that's fantastic because, again, they say these things in a measured way, but once again, these things can change. We can see that from, either when they do it in more than just, as I understand, it was like 11 monkeys, right? It wasn't like 100 or anything like that. So we could see some differences in bigger numbers. As far as, I think they'll be able to produce it, pretty rapidly. And like Dr. Sidhu was saying, you don't need 7 billion to, cover everybody. But I think if we can get the hot spots and the areas that we're most worried about, I think it'll help all the other ones. And I think I'm not exactly sure if there would, in a situation like this, would there be patent issues where they say, no, only we may produce this, we're not going to give it to others. Although at a time like this, it seems like people wouldn't pull, tricks like that. So hopefully once it's on board, I think it can actually be produced pretty rapidly if you have multiple centers, cooperating on it. It's that initial step of, does this thing work? Which, I guess we'll find out soon enough.
Question just came up from Nancy Flynn about the vaccine. When the vaccine does come out, how can the public be assured that it's safe? I guess vaccines have a safety margin, I guess, or unsafety margin. Is that going to get disclosed, or how does that typically work? Dr. Sorabi?
So this is something I mentioned last time as well, is that on the one hand, we want solutions and we want them now, and on the other hand, we want them safe and we want to make sure, it's really going to work and so forth. So it's a little bit of a push and pull there. And I think Dr. Sidhu has gone over this previously as well. The way that you trial these things out, first, you got to make sure that, it doesn't kill a rat if you give it to like a monkey or something like that. And then afterwards, you got to make sure that it actually works, and so then you got to see, okay, now does it, we know that it's relatively safe in organisms and, and it's effective, but let's try a small group of humans and see if it's the same in humans. And then you do a big group of humans and then you've got your actual study. So there are those steps that we do, and they do that for all medicines, vaccines, any of this stuff. Which is why some of the supplemental, things are an issue. They're sold in stores as advertised this and that, but they haven't gone through this process. And sometimes they've had to be recalled and so forth. So just understand that on the one hand, we say, give us the vaccine, give us the proper medicine or whatever. But if you really want that to work, you got to take some time and do the tests. Theoretically, you can be safe to a degree, but there does have to be a waiting period. That's why they say it won't be ready till September. it's not necessarily because they don't have enough chemicals to mix it, enough bottles to put it in. It's that they've got to test it against a small amount of human beings, make sure it doesn't, God forbid, kill anybody here, and then to make sure it works, and then against the big batch, which in this case, they probably will roll forward with the big batch just in the population, just because of the timing reasons. Otherwise, we would have to wait till, 2021, 2022, things like that.
Yeah, about 1,100 people in that study, the one that was announced this morning by Oxford. Dr. Sidhu, any additional comments on that?
Oxford is one group of many that are working on a vaccine. And one of the things that we're seeing with vaccine production as a whole that's very different from any other vaccine that's been made is that even though a lot of these companies don't have the actual vaccine yet, they're working on simultaneously ways to, right when they do have a vaccine, make large quantities of it very quickly. And that is a huge sunk cost for a lot of these corporations and organizations.
Exactly. Nancy Flynn has a follow-up question. So there's a lot of folks, or some percentage of the population that do not believe in vaccines. Do you believe this is something where our government can actually mandate folks to be vaccinated against COVID, or not in this country?
I don't think so. Yeah, not really possible. There are people that don't believe in vaccines and so forth, but the way, like, you talk to some of the older physicians, even my dad and stuff like that, I ask about some of these things. Well, did everybody really have to get vaccinated against smallpox or whatever? He just looks at me and goes, man, you don't know what it was like, before you had these vaccines. So there are some things where we can mandate everybody to, some horrible, horrible diseases that could take us all out kind of thing. I don't think COVID will be mandated. The same way that, there are a lot of other vaccines that can't be mandated, especially for adults, which, I mean, you kind of want that to happen, but I totally understand why you cannot mandate from a government standpoint. Now, you can say that in order to, be a federal employee, you have to get this vaccine or something like that. Okay, well, that's a little bit different, but to say that if you don't get this vaccine, you're going to jail, I don't think it'll work. And I think it will cause a backlash that will be really antithetical to the idea of what we're trying to do here. I think the best thing to do is to just bring the education level of the population to the point where they'll be like, aha, I see why we want to do this, and I'll kind of go along with it. But you're never going to get that. There are right now people who don't get not just the flu vaccine, but old people don't get the pneumovax, people who don't want to vaccinate their children. And then you get rubella outbreaks. You get, children dying in horrible ways from meningitis that shouldn't be happening because they didn't get the Haemophilus influenza vaccine and so forth. So I think those people are very lucky that they live in a place where most children are vaccinated and that we have generally healthy, clean, somewhat, public infrastructure. I think those guys would be begging for vaccines if they lived in a different society where 6 of their 9 children died of measles or something like that. And that's what I'm not trying to be very harsh about it, but that's how I feel.
Got it. Any comments, Dr. Sidhu, before we go to the last topic?
Yeah, no, that's absolutely true. I think it would be very hard. There are anti-vaxxers out there. There's a lot of, even before COVID-19, I do think that there's no way to actually absolutely mandate, the government mandate a vaccine. There are ways like, you may not be able to go to school, or you may not be able to be a federal employee, like Dr. Sarabi said, which already is in place in some areas, and it does seem to work. But maybe one thing that COVID-19 has taught us is that vaccines are maybe not as bad as some of these anti-vaxxers thought from the beginning of this, and maybe their minds are changing as we are all so desperate and clamoring for a vaccine for COVID-19 now, and seeing not only the health, but also the economic effects of what's going on.
Exactly. And Governor Newsom came out yesterday with a several-point plan, but it looks like concerts and large gathering places are months away. Actually, not until a therapy or a vaccine is out. And then other gathering places are going to be prohibited. and it was unclear to me whether restaurants fit in that or not. Do you have any thoughts on what is a safe time? You know, a lot of restaurant operators, owners, servers have been damaged substantially financially. And once the payment protection plan rolls off end of May, I mean, if it does become a cliff and there is no extension, there's a lot of folks that are going to be unemployment lines and suffer financially. But of course, there are health risks as well. Any thoughts on when restaurants should open, at least in our area? Dr. Sidhu, we'll start with you.
Yeah, sure, I could take that. So I do think that this is definitely an industry that's probably one of the hardest hit by COVID-19. But I do think that once things open up, I don't know exactly when that would be, when exactly it would be, particularly for the restaurant industry. I think we're all trying to figure that out, and we're waiting on our legislators to help us figure that out. I do think that there will be a population subset that may not feel safe going out and having their meal. They would prefer having kind of like what we have now, takeout and then eating it at home or eating it in a smaller gathering. I think most of the restaurants will have to adjust and change the way that they do practice and how they do their business. And I think a lot of them are working on that now, which is great. But in terms of an actual time when we'll be back to going to our local burger joint and having burgers with everyone around us, I don't know exactly when that'll occur or when people will feel safe to do that.
I think it's going to have to depend on testing. The vaccine won't be out quick enough. It's got to be testing, you know, and I know right now, multiple hospitals, I know people are getting the nasal swab, which will tell you if you have the active, you know, virus on you. They look for the RNA of the virus in your nasal pharynx, really. I've gone over why I think it's a problematic test, but at least we have that. And we've got better and better, you know, blood tests for it too. So those are the two we got. And the nasal swab thing can be pretty quick. I definitely know at one of the hospitals, it's an hour turnaround, whereas the other testing is 72 hours. So if you have, you know, if you have an area that you see that most people either have IgG, meaning that they have, you know, had it and they've cleared it, you know, and they don't have anything active in their nose, you say this person is immune, you know, even that's not a 100% thing. But I think if we can show that we have gone over the cliff and we're on the way down, then I think it's safe to start it. But if you can't show that, you know, I don't know who the person who's going to be, you know, saying, yeah, come on into my store. And I said this before too, and this is not a medical answer here, but I think that if we could prevent our restaurants who do a bigger part in society than you may think, is not just getting calories. It's, you know, where you meet friends and you go on a date and you see new people and stuff like that. I think if we could keep these people who are already operating on razor thin margins, if we could help them financially, then maybe they'd be totally okay staying, you know, I've kind of said this before as well. If we can use our vast financial resources and so forth, maybe divert them for some other things that we've been using them on, I think we can float this industry and other industries and just the individual people on their own. I think we can float them through this period. And I think we wouldn't be having people clawing to get back in and coming up with, you know, statistics that show everything is okay, just open up the businesses. And I know that they've been doing it. I don't know the ins and outs of how you can get money into everybody's hands, but I have a feeling that we can do it. I mean, if we can spend multiple $1 trillion on, you know, aircraft or something like that, I think we can give it to people so they won't be so worried.
Well, I mean, here's an idea. I think there's an organization, East Coast, that's doing this actually internationally. You're getting federal dollars to go directly to restaurants in every community across this nation for them to prepare food for the homeless. Yeah, you employ folks, you get the restaurants back in business. They're working full time, and they cover their margin and provide food for those folks that can't be don't have the ability. We're going to be talking more about that in the coming weeks. How about antibody tests? Is any of that happening in the Fresno area that you're aware of? The immunity, yeah.
Yeah, it is happening. I know a couple of hospitals that I can only speak for are sending it out. Do we have, how about downtown? Are they doing the tests in-house?
I don't believe that that's happening at this particular time.
I think they're sending it out. There are some places closed. I think most of ours end up going to, Palo Alto. But there is a quick, about a 72-hour tops or turnaround time on those. And again, the antibody testing, it's got to be taken in light of the nasal swab as well to know if you're in the middle of an infection or if you're over an infection. But the nasal swabs can be done in an hour. I think we're definitely getting better compared to where we were a month ago. We have a lot more available tests, and I know the hospitals, they kind of keep hush hush how many tests are available, how many more they wish they were doing, because sometimes it exposes, it makes people more afraid or something if you say that we're operating at 5% of the tests that we wish we could do, so it's hard to get the actual numbers out, but I will tell you the trajectory is upward. We're significantly increased the amount of testing and the quality of testing. I mean, some of the early tests were just not reliable at all, and it's gotten better.
Yeah, just a few hundred tests a few weeks ago, and the numbers as of yesterday, 6,800 tests in Fresno County.
Right,
Not
right.
quite 1% of the population, but we're ramping up. Dr. Sarabi, you were going to talk about how to put on a mask.
Oh yeah, and listen, it's one of these things where you walk around, you see people wearing masks, which is, great. I think if you look at like videos of, even just random, news clips from somewhere out in like Japan or whatever, you see people walking around with masks and you say, what's going on? They say, oh, that guy has a cold. And so he doesn't want to give it to other people. So he wears a mask. So I'm not saying, wearing a mask is only for this situation, but if you are going to wear a mask, and you should be right now, as we know, state of California, I just want to say, especially if you have an N95 mask, which is a special thing. It's not, if you got one, you're lucky, so I just want you to use it correctly, because I see people not using it correctly at all. So if you've got it, there's one thing I want you to know. This part is probably not going to break unless you poke it with something, or if you get it wet, okay? And that's the filter right there, just the front right there. So don't be touching the front. Now, this is a new one, so I'm not going to, but this is where all the virus and whatever gets trapped. It's not on the inside. It's not in the other layers. So, don't touch this outside so much. The only time you should essentially touch it is when you're putting the mask on. The way to put the mask on is like this. You take it in your hand like this. There's two straps. There's one on top and one on bottom. You take the bottom one first. And ideally, the bottom one should be a little bit higher on your head. And then you take the second one like this. So usually they're technically supposed to be crisscrossed. The reason for that is that one of the main places where you get an air leak is at your chin. So with this going upwards, it actually helps hold it against your chin. And then you kind of pinch this just to, match your face. The way that you know it, that if this is actually doing anything for you or not, besides the fact that if you just go, if all the air comes up in your eye, okay, well, obviously it's not working. But when you get it at the right adjustment, you should be able to put your hands in front of it and breathe in quickly. And you should feel the suction against your hand going through the front part there. And when you've got it on, leave it alone. Don't mess with it. Don't adjust it. Don't go like, get it to the place where you want, then leave it alone, okay? And then when you're done, you just do the same thing in reverse, okay? Top one off, bottom one off. End of story. So this you kind of put in a bag, you leave it alone, because it's got a virus right on the front there or whatever it is. So people who are wearing it off of their nose, only covering their mouth, it's not doing anything for you. people who are wearing only one strap, it's not working because it'll rock back and forth and at least one of the sides will be open. If you're lucky enough to have an N95 mask, use it correctly, please. Or give it to someone else, who will use it correctly, so you actually get the benefit from it, That's all. That's all.
Good. So before we go to closing statements for both of you, Dr. Fauci came out and said, do expect a second wave. Could you please address that in your closing statements? Are we going to get a second wave this summer or fall? Let's start with Dr. Sidhu and your closing statements.
So the possibility of a second wave is very highly likely. Now, if we look at other diseases that we've been using as historical markers as to how to deal with COVID-19, like SARS, back in 2002 to 2003, we saw that there was 2 waves of SARS at that time, SARS-1 and SARS-2. Now, I anticipate that if we open up too early, and we don't have the adequate testing, the adequate tracking, the adequate ability to treat, then we will see a rise in numbers and a second wave. More states are opening up, more cities are opening up, and it will be interesting to see what's happening there. Other countries that have already opened up are starting to see an increase in the number of COVID-19 patients. Now, the second possibility is that should the winter come around, should the fall come around, we will then see another spike of COVID-19 at that particular time. Now, the bad thing is, particularly in the wintertime, we as ER physicians would be fighting not only COVID-19, but also the flu, and that's something that's quite concerning.
Dr. Sarabi?
Exactly. I don't have much to add to that except to say that just when you study epidemiology, this is what you find with, you will get this kind of second wave. But that's not to say that that doesn't negate any of the stuff that we've been talking about. Because what you would have is ideally a wave, and we curb it, we break it, it comes down, and then due to things beyond our ability to completely control, it will come back up. But if you don't do it, you could have this thing where it doesn't dip back down between the 2 waves, where it just keeps going up, and that'll be the worst of all. So you didn't get a second wave, so you think it's good, but it's not, because that just means you never got over the first wave.
Right.
So just because you hear the second wave, don't think that that's terrible. It's it's all for nigh. So take that with a little grain of salt. But he's probably right. If anybody knows, it'll probably be him,
No, exactly. And one actually question that came up, and I've always wondered that myself. Can you disinfect the N95 mask? Is it recommended? And I don't know if you either one of you gentlemen can comment on that. That's probably a manufacturer question. I'm thinking, can you just take Lysol and apply it and then let it dry out and then reuse it later on? If you don't feel comfortable commenting, don't. I know it's a manufactured product by several manufacturers, but any comments on that before we wrap up?
Well, I wouldn't say the Lysol just because I don't know. If somebody does a study on it, that's fine. But the 2 that we know for sure, I'll say 3, that we know for sure is nebulized hydrogen peroxide. The protocol is pretty widely, available. Started out at Duke University. Other hospitals all over the place are doing it now. And this is not to say you take hydrogen peroxide and pour it on your mask. That's going to destroy it. It's the delivery system, the nebulized, so that it kind of like small little bits in the air, so that you're not overwhelming any part of the mask with fluid, to cause changes in the fabric. The second is UV, which so far we've used some. We got these little boxes you can put your cell phone in. The UV kills everything. Fine. These 2 ways are known, but again, you'd have to have the right amount of time exposure to this kind of stuff. The other one, which again, you'd kind of have to be either not going out a lot, or if you're going to work like us and you have to have or be able to rotate your masks. You take the mask after you're done, you put it in a bag. It doesn't have to be airtight, as long as it's not open to open to other people's respiratory droplets. You put it away, and you can keep it there for 7 days for sure. Then when you take it out, then it should be okay. And that's like no products, no chemicals and no way to really mess that up. Unless you keep opening it and taking it out and putting it back in, then obviously that. But those are the three ways which people have access to. I won't try to say it here, but it's available online. I guess maybe we can find it and put it up somewhere. But the protocol at Duke and probably most of the local hospitals have this information as well. So nebulized hydrogen peroxide. Now, the Lysol, will it kill the virus on your thing? Probably, yeah. But is it going to ruin the integrity of the mask? I mean, I bet you the 3M company is going to tell you, please don't spray our masks with Lysol, you know.
Dr. Sidhu?
Yeah, definitely. Going back to that study, the other thing to realize is that with the nebulized hydrogen peroxide, certain hospitals are doing that should they run out of the N95 masks, is that even that procedure for about 30% of the cases does change the construction and the usability of the N95 mask and making it essentially non-usable because it doesn't provide that same seal that it did prior to the reusing process. So that's something to just factor in mind when doing the disinfectant thing. In terms of the Lysol, I think, that also may have some damaging effects to the mask, and I'm sure 3M wouldn't be proud of us doing that.
Okay. Awesome. With that wraps up today's session. Hopefully we get both of these gentlemen back out next week or the week after, especially after the May 7th shelter in place in Fresno. We'll take a look at it, see if that's lifted or not. Thank you to all the audience and for your questions, and we hope to see you next time. On behalf of all of us at GVWire, thank you everybody, Dr. Sarabi and Dr. Sidhu.
Take care. Pleasure as always.
Thank you.